on the flu in central Ohio. As the flu season continues, local urgent care clinics are flooded with patients, and that is taking a toll on those facilities. NBC4's Tyler Carter is live with that story tonight. Tyler?
Good evening, Ellie. You know, urgent care facilities like this one here in Worthington, they're seeing anywhere between 50 to 100 people with flu-like symptoms a week, and because of this, they're running low on flu testing kits. Waiting rooms are filled with people who are showing signs of the flu. Coughing, aches and pains, nasal congestion, the list goes on and on. The amount of people showing up sick isn't stopping anytime soon. Patients like Paige Wilson finally checked herself into urgent care clinic after feeling sick for several days.
I had like a sore throat, kind of like body aches, a little fever, so I just wanted to get checked out to make sure it wasn't more than a cold.
This year's flu strand is more intense than in previous years, says physician assistant Morgan Leach, with H3N2 or influenza A being the one hospitals and urgent cares are seeing the most.
It's tricky because it changes as it goes around the world. And so when we put those strains in a flu vaccine, while we may be getting the worst of the strand, it changes as it goes from person to person.
Doctors here at Worthington and Upper Arlington Urgent Care are starting to run out of flu test kits. They are now only testing those who have a severely compromised immune system for influenza A and influenza B.
A is generally what causes the most of what we would define as a flu epidemic. It tends to have the most severe symptoms with the high fevers, people getting dehydrated, or symptoms that would then lead to pneumonia. Physicians say they don't see cases of the flu slowing down anytime soon. The Ohio Department of Health has confirmed more than 7,000 influenza-associated hospitalizations this flu season since October. 567 people were hospitalized for the flu in Franklin County and more than 1,000 in Cuyahoga County up in Cleveland. Doctors say it's important you get a flu shot. It takes 2 weeks for that flu vaccine to kick in, so odds are if you have ended up with the flu right after getting the vaccine, it's because you were just unlucky. And doctors here tell me that it's not just the flu that people need to be concerned about. They also need to be worried about viruses like strep throat and pneumonia. Local for you in Worthington, I'm Tyler Carter for NBC4.